Hello physios, get back to my channel. Today we learn on anatomy, head and neck region, foramens of skull. What are the foramens of skull in human body? Firstly, we'll deal with foramen oval, which is most important. How you would write in 2 marker when it is asked in exam. A foramen oval is a foramen in the greater wing of sphenoid bone, and the foramen oval is one of the two cranial foramina in the greater wing, the being foramen spinosum. The foramen oval is posterolateral to foramen rotundum and anteromedial to the foramen spinosum. Then what are the foramen oval getting transmits? There is a mnemonic MALE. M stands for middle meningeal artery. A accessory meningeal artery. L lesser petrosal nerve. E for emissary veins. So these are the transmission to the foramen oval, as you can see in this picture. Next, jugular foramen. What you will write? This foramen is between the occipital bone and petrous temporal bone. It is present in lateral area of posterior part of normal basalis. It is large and elongated with its long axis directed forwards and medially. So this foramen may be subdivided into 3 compartments. Your anterior compartment, has inferior petrosal sinus, intermediate compartment 9th, 10th, 11th cranial nerves, and your posterior compartment is about sigmoid sinus and its meningeal branches. So its anterior wall, that is a petrous temporal bone, will be hollow out to form jugular fossa. In that it contains superior bulb of internal jugular vein, and the fossa is larger on right side than left side. So near its medial end of jugular foramen there is jugular notch. So apex of notch opening leads into the cochlear canaliculus. Next, foramen magnum. This is also important to write in exam when they are asked as 2 marker. Foramen magnum is a large oval opening in the occipital bone of skull in humans and other various animals. So, the spinal cord is an extension of the medulla passing through the magnum as it exits cranial cavity. Foramen magnum transmits vertebral arteries, anterior and posterior spinal arteries, your tectorial membranes and alar ligaments. It transmits also accessory nerve, which is most important. Next, alar ligament getting attached on side to the tubercle of occipital condyles. As you can see, there are some of the occipital condyles between these two occipital bone. There are some condyles on each side of foramen magnum, and it divides into anterior and posterior compartments, which is smaller and larger compartments. Your anterior compartment has apical ligament, cruciate ligament and membrana tectoria. Posterior compartment has your meninges, fourth part of vertebral artery and accessory nerves, anterior and posterior spinal arteries. So these are the contents in the posterior compartment of foramen magnum. So these are the most important of foramen magnum. One is your foramen oval and foramen magnum and jugular foramen. Thanks for watching SPN.